With over 1,800 clinicians and a record number of new industry attendees, Orlando had a lot of buzz at the Spring Symposium for Advanced Wound Care. The most significant buzz in news was on the draft LCD for Cellular and Tissue-Based Products, CTPs, that was issued on April 25th, which proposes to reduce the number of covered products from over 220 to 15 based on the existence of clinical evidence, and it's also capping treatment at 4 applications. This draft proposal, as written, would have major consequences for this $2.2 billion U.S. market with a previously predicted growth of 9.8% CAGR. This is the second LCD issued in less than 12 months. So when talking to many of the attendees on the floor, it kind of felt like speaking to native Floridians ahead of an approaching Category 4 hurricane. Yeah, hey, we'll wait and see what happens when it gets a little closer. Well, I did spend a lot of time, though, with industry leaders and listened to the comments and responses from the medical directors during the MAC Town Hall that happened concurrently with SAWC. Now, there's still many unknowns, but a few things seem pretty clear when this LCD comes into effect. First, evidence will matter for coverage, which is something with the rapid growth of options in the category, the need for more evidence was universally felt to be positive for the market. This change will create rapid consolidation of utilization to the products that have evidence and or have the means to do the RCTs to capture them. Now, there's already a push for clinical studies, and with limited patients and institutions able to do it, I expect a bit of a gold rush for wound care clinical studies. Second, there will be a constriction of number of uses. Don't know how many, but there will be. Third, there will be a change that will alter the trajectory of advanced wound care. We'll see how it happens, but it will change. Now, change in reimbursement doesn't mean that there will not be a growing population of patients that need care. And now there are companies and solutions whose demand will be accelerated by this change. The first area is an improvement in diagnostics. Whether it's information around bioburden from companies like MolecuLight or data and traceability of the wound from companies like MIMOSA, whose recently launched handheld scanner is welcomed by industry and clinicians alike. There will also be an acceleration of adjacent autologous therapies from solutions like ActiGraft from RedDress and the 3C patch from Reaplex, which already has national coverage determination. Biologics was not the only buzz at SAWC. We saw 2 launches that can impact the dressing market. The first is from URGO, which launched in the US the URGO Clean AG wound dressing that supports the continuous debridement of slough with the benefit of silver. The second was from convatec, whose new ConvaFoam allows easier application and adhesion with an atraumatic removal. Finally, I learned at a wound care conference about a solution that will change orthopedics. ORGANOGENESIS released preliminary data on their phase 3 trial reviewing the impact of a product Renew on pain associated with osteoarthritis of the knee. Now, with 32 million people suffering from knee OA, when Renew is approved by the FDA, it could take Organo from a market leader in wound care to a market leader in orthopedics as well. Now, we're really excited about the buzz we captured, but I know there was a lot of great changes we missed in this dynamic market. So please comment below with the advances that you're excited about. And I look forward to seeing you in Vegas this fall.